Hi guys, my name is Jessica Espinal, and the topic I will be speaking about today is adherence and mental health issues in chronic disease such as diabetes, heart disease, HIV, and AIDS. Okay. So differences in population. So what makes this population so unique? The treatment noncompliance is a key factor that contributes to poor medical results in clients who have mental disorders along with a chronic disease. So, mental disorders sometimes is accompanied with the chronic disease. Mental disorders can be anything from depression to bipolar to schizophrenia, anxiety, and chronic diseases including diabetes, HIV, COPD, heart failure. So both mental and physical illness can make it difficult for a person who is suffering to continue to manage their lives and daily routines. So working with this population is unpredictable. One day the patient might be feeling fine and make reasonable decisions regarding their treatment, um, and while the next day their cognitive abilities become impaired, which may make it more difficult, and the patient may have more poor decision making skills. So, according to Hop et al., this is the article that I touched upon in week 5. Research exploring the experience of those living with chronic illnesses showed an increased social isolation and physical symptoms of fatigue in both the patients and the caregivers. So moving on. So challenges and needs with this population. So one main challenge that I specified is that a patient suffering from a mental health issue along with a chronic disease, it may make it difficult for the patient to cope with their emotions that may be accompanying their illness and treatment. So a lot of times patients may not be mentally stable, usually do tend to have an imbalance in their neurotransmission and hormones, which can affect their treatment adherence and their decision making skills. So that is definitely one challenge with this population. A second challenge with this population is that patients who have a chronic illness may face is accessing resources such as transportation and home care. So, a lot of times, if you see that these patients may not be mentally stable and may decide to terminate his or her treatment episode, having nowhere to go or no means of transportation. Sometimes this does happen when they have the ability to cognitively make their own decision about their treatment. However, they decide to make the unrecommended, I would say, decision and just leave the hospital, the home care, and they really have nowhere to go. Okay. So, addressing challenges and needs. So, as a social worker, I would definitely make sure that I educate, coach, and support my client and their family on their illness so that they're more aware of the presenting concerns and ongoing treatments. I would also make sure that to connect the client to a psychiatrist so that they may possibly receive pharmacological treatment. So if they do have an ongoing mental health issue, we want to make sure we address, their diagnoses, or if they haven't been evaluated, maybe they do need an evaluation. So they do need a referral to a mental health provider with a mental health provider, so they can possibly get medication, and this will help them become a little more stable and level-headed in order to make a decent positive decisions in their treatment. Okay. So addressing challenges and needs. I would assist my client helping them manage their emotions also by connecting them with peer support groups in the community that may be able to support my client with knowledge, emotional, and social help from others that may also be experiencing the same problems. So a lot of times, people who have a mental health issue, in conjointly with a chronic disease, they may find themselves socially isolated, not having too much support. So definitely finding some type of social support, peer support in the community can provide them with the help that they may need. Majors, I think is the peer that I had that answered my question, and she also suggested that a lot of patients who have chronic illnesses can benefit from peer support. As a social worker, I can also teach my client the 5 coping skills for chronic pain to deal with chronic pain, whatever kind of chronic pain they may be experiencing. So, resources needed as a social worker. So, as a social worker, I would definitely need to be educated on both the mental illness issues and chronic disease that is impacting my client's life, so that I may be able to further assist in providing the best quality of care. So I want to make sure that I do know what type of symptoms they're experiencing and how this is affecting their lives. So I want to make sure how I can address their mental health or their chronic pain, and what treatment kind of techniques we can approach. So, and interventions we can use. So, hope at all. This is again from week 5. The article that I use suggests that illness informed social work is needed to educate social workers about specific illnesses, as they can better be prepared in the work field, which I completely agree with. So, after completing the biopsychosocial assessment with my client, gathering information from the physical well-being, mental health, physical environment, and family support, just to name a few, I can then access their needs and figure out what resources I would need to collect to further assist my client. Again, I would also have to do my research and make sure I'm familiar with the community and its resources. Okay. So, resources that the client needs. So, these are just to name a few. The client may benefit from resources from the community, such as I mentioned earlier, peer support groups, transportation assistance, self-care programs. Especially with mental health, self-care programs would benefit, just their daily routine and how to make sure they're eating right, they're eating what they're supposed to, they're taking the medication as prescribed and appropriately, and they're, just hygiene and self-care in general. So transition home care, we can possibly connect them to a physician who can provide medication and counseling services, finding a mental health provider, which goes with physician after receiving treatment, and possibly other state benefits such as supplemental income assistance. Okay. So my social work skills. So I just named a few. So working in the field of social work has given me the ability to empathize with others and applying my skills in practice. So I consider myself a good listener, which is a quality that has enabled me to build positive rapport with a lot of my clients. So listening to my clients' stories, I want to understand what is being conveyed to me through body language, direct contact, and verbal affirmations such as I see. So I work at a substance abuse clinic, which has given me the opportunity to learn to utilize motivational interviewing skills when working with these clients. And lastly, I am bilingual, so I speak both English and Spanish, which is a skill that has helped me with my Spanish speaking clients and assisting in translating the appropriate information to the medical staff. Okay, and the last page is my reference. All right. Thank you guys for listening.